Hi, my name is Joe and this is Susan. In this segment we show you how simple and quick it is to enroll in the health insurance plan that's right for you on Marketplace America. First, we would like to introduce you to Marketplace America.
Marketplace America gives you access to marketplace health insurance plans on the Federal Exchange. Our site is fully integrated with the Federal Marketplace, which allows you to access live insurance quotes in less than 1 minute. And once you find a plan you like, you can enroll in about 7 minutes.
Let's go ahead and look at how simple and quick it is to enroll in a health insurance plan that's right for you.
This is our Marketplace America software. We're going to show you just how easy it is to enroll in a Marketplace health insurance plan. But first we need to redo our quote.
Alright, so we're here at Find Your Health Plan Now. And again, to do your quote, all you got to do is have your zip code, okay, and you type that in. And remember, you want to go ahead and do steps 1, 2, and 3. 3 is the magic box that appears here in just a second, okay, before you actually start looking at your plans. Now, in our example, how old was our...
Right, he was 45 years old.
Okay, and did he smoke?
No, he was a non-smoker.
All right. Now, get lower prices. Household size was 1, and our annual income that was estimated, again, it's estimated, it's $19,000. I'm going to enter that, and as soon as I enter that, it pops up the magic box 3. That's the subsidies the taxpayer actually qualifies for, or you actually qualify for. That's going to reduce the amount you pay out of pocket. Now, you're going to go ahead and go through the Find It, okay? You can sort it, you can find the plan that's right for you, and once you find the plan that's right for you, you're ready to actually enroll. Now, Susan, what I want to do to find the plan that's right for this person is I want to find the lowest cost plan that has a copay. And which one's that going to be?
That's the first plan listed. That's a bronze plan, 0 monthly premium, and it has a copay plan as well.
All right, so the amount that you're going to actually have to pay out of pocket for this plan is going to be 0, okay? And it does, if you'll notice over here, you've got copays. You don't want to drop down here and pick this one because with this one, they don't have any copays, and you got to pay this full amount out of pocket first. So you really want to pick this one, and we're going to click on Enroll right here, okay? And once you click on Enroll, it takes you to another screen, and you really got 3 steps again. You got to get information about you, the applicant, and then you got to get information about your household, and then you have to confirm some statements. And once we finish steps 1, 2, and 3, you're really done with enrollment. And we're going to go ahead and walk you through this and show you how simple and fast this is. Susan, what have I got right here? Taxpayer's first name or applicant's first name?
Right, it's John Smith.
Okay.
Okay, and his street address, 123 Main.
And if you had a house or an apartment number, you would want to put that right here. And then the city is
Greenville, South Carolina 29601.
okay. Now, if your mailing address actually differs from this address, you would want to click on this, and you're going to have more fields that you can actually put your mailing address in. But if your mailing address and your street address are the same, you want to leave that unchecked. Now, we got to get an email address.
That's right.
So let's say this john@gmail.com, and let's say his phone number is 864-907-1111. Okay, so you got your phone number in there, and then you've got contact preference. If you look at the drop down, you've either got email or mail. Really, what you're talking about here is how do you like to receive your bills?
Right.
And chances are most people still like to receive their bills through the regular mail because emails get lost quite frequently. So let's go ahead and change that to mail. And then if you have subsidies, you want to make sure this box is checked because that's what's actually lowering the cost of your health insurance. Susan, that's it as far as the applicant's information. That was pretty simple, right?
That's right.
So after we got that, we're going to hit next, and then what do we got?
Right, just a few more information about the applicant. We got his name, and then we're going to do his gender is male.
All right, so I'm going to come down here. Again, it's already got his name. It's filled in, but there's some boxes we need to fill in. We got male, and we need his date of birth.
It's 6/1/1969.
Okay.
And his social.
And you type in the social. And reason applying for coverage. Okay, this is really for special enrollment purposes. This is not going to be here during the open enrollment purposes. If it is, you can actually click on it and answer it appropriately. But for purposes of this, we're going to go ahead and key in information so it'll flow through and you can see how it works. Okay. And again, this is our estimated annual income. Now this would be John's estimated annual income. And how much was that?
Right, his income was $19,000.
Okay, we're going to enter 19,000, and then we have to know his income source, and we're going to just say that's from his job, and then we need to know his employer's company name. Let's say that's ABC Company, and his employer's phone number. Okay, so you complete that information. Now, Susan, we've got some boxes down here. What are these for?
Right, those are just additional questions. So you want to check that he is a U.S. citizen.
It's already checked.
We said he's single, so he's not married.
All right,
so
we'll leave that unchecked.
He's not a parent or a caretaker.
Okay.
We said he was tobacco-free.
Okay.
Not a full-time student or a Native American.
All right, so you just check the boxes that apply to you. Okay. Now, if I want to come down here, I've got how do you plan to file your taxes for 2014? And I've really got three options. I've got single filing taxes, I've got single claimed as a dependent, and I've got single not filing taxes. Susan, how do you think he's going to file?
Right, he's single and he is going to be filing his tax return.
All right, so we're going to click on single and filing taxes. So that's the left side. Let me come back down the right side over here. What does this say?
Is he eligible for insurance through his employer? And John is not.
Okay, so if he was eligible for that, you check that, and he's not, so we're going to leave it unchecked. And are you currently enrolled in any of the following programs? And this is basically individual health plan, not from an employer, Medicare, Medicaid, or VA. And really, this is really asking that question, do they have a qualified offer? Do you have a qualified offer of health insurance? Because if you've got a qualified offer of health insurance, typically you're not eligible for marketplace health insurance.
That's correct.
Okay, so we're going to leave all that unchecked, and then we're going to hit continue. But Susan, if we had another person in the household, all we do is click on add a person. We'd put their information in here as well. We don't, so we're going to hit continue. And what do we got here?
Right, this is the last step on the confirmation, and we have 5 statements that he needs to be able to agree with and check those boxes.
That's right. Before we look at those statements, look, we did step 1, that was applicant. We did step 2, that was a household. Now we're already on step 3. It's really that fast. It's really that simple. So now what you need to do, again, is come down here and read these statements, be able to agree to these statements, and once you agree to these statements, you're going to be able to click submit, and you've actually enrolled for health insurance.
That's how simple and easy it is to enroll in your plan on Marketplace America.
If you missed our videos on getting a live estimate in 1 minute or less, or finding the plan that's right for you, make sure and check those videos out if you feel you need more information. Otherwise, you're ready to choose the plan that's right for you and enroll in your Marketplace health insurance plan.